Hello everybody. I hope you're having a wonderful, wonderful day. This is your mouth to stomach video, so we're going to learn all about your mouth and your stomach and the jobs that they do. So your mouth's job, it's also called your oral cavity or your buccal cavity for those of you that want to go to dental school, because the inside lining of your cheeks is your buccal area, if you remember that from A&P 1. So your mouth, right? Its job is to ingest the food, right? Taste is also a very important part of this, as well as mastication, that is chewing, swallowing the food. It begins the chemical digestion process, and, as added bonuses outside of your digestive system, you can speak and breathe through your mouth, right? The front opening of your mouth, it's called the anterior opening or your oral orifice. It's where you're putting the food. The posterior opening of your mouth, where you are swallowing your food, the back of your mouth, is called the fauces, right? And all of the tissue layers that are within the inside of the mouth are stratified squamous epithelium. If you remember what that means that there are layers of small, short little disc-shaped cells. This is why they are good to collect if you are ever doing like an Ancestry.com or a 23andMe kind of DNA testing thing. They're going to ask you to rub a Q-tip on the inside of your cheeks, because they're going to get a decent number of little bitty cheek cells that they can then get your DNA from. Right? Your mouth, you're going to have lips on the outer side of it, the cheeks on the inside, teeth, tongue, and all that kind of good stuff, right? So chewing is when you start the mechanical breakdown of food. Your fancy word for chewing is mastication. Most high schoolers figure out that word and think it's like the funniest thing on the planet, because it sounds like a very naughty other word. Part of chewing is voluntary. You guys control when you chew. You all know that your mom would smack you upside the head if you were chewing with your mouth open, right? Or you would smack your own kids upside the head if they were chewing at the dinner table with their mouth open. So part of chewing is voluntary. You can control it. Part of it is also reflexive. So unless you are actively thinking about how you are chewing, your brain is kind of just reflexively doing, putting things where it does reflexively to chew in a specific pattern. So you have a specific pattern and rhythm of chewing controlled by certain reflexes and responses to different receptors in your tongue, gums, and cheeks. This is why sometimes, let's say you never realize how you're breaking down and chewing your food, but all of a sudden, something happened to a tooth, or your wisdom teeth started growing, coming in, and one side of your mouth suddenly hurts, and now you're why does eating and chewing hurt? Now I have to think about chewing stuff on the other side of my mouth. That's why. Some of this is just reflexive, and you get in a rhythm of it, you teach yourself how, and then you move on with life. Right? Your tongue is actually broken up into a multitude of different receptors. You have a number of them. The lingual frenulum is the little bitty piece of skin that attaches the tongue to the floor of your mouth. It can actually be cut as a cosmetic surgery in other parts of the world, because in places like China, they believe you will speak English with less of a Chinese accent if they have that cut or cauterized when the kid is young. We don't really do much with it in the U.S. It's kind of just there, and you notice it. Yeah, there are intrinsic and extrinsic muscles for your tongue, meaning there are subtle movements and strong movements. This controls everything from swallowing to enunciating words, all that kind of good stuff that you use your tongue for. All that kind of good stuff. And this is a rundown of all of the lovely taste bud regions where you have receptors found. Filiform are the most numerous. Fungiform are scattered throughout the tongue. The circumvallate is the V-shaped row on the back surface. You're going to find a lot of bitter taste receptors there, because you can always taste if you're about to swallow something bitter at the back of your throat. And that is actually a survival mechanism, because most poisons or things that will poison humans have a bitter taste to them. foliate stuff is the lateral or side surfaces. So these would be your foliate papillae on the sides of your tongue. And that brings us to your salivary glands, right? You have 3 major sets of salivary glands, and saliva does a number of good things to your body, right? You have some intrinsic salivary glands, which are the buccal ones along the inside of your mouth. The main ones that are big glands, though, are the parotid, submandibular, and sublingual ones. So you have one under your tongue, under your jaw, and at the side of your jaw where your cheeks are. And their job is always to secrete saliva, right? So saliva does some good stuff, and here are pictures of where your glands are. The parotid ones are in your cheeks right here, right? The sublingual gland is underneath the tongues, and then the submandibular ones are along the bottom sides of your mouth. Right? Saliva does some good stuff. It is the first thing that starts breaking down simple sugars that you are eating. Saliva, in addition to starting to break down starches and other sugars that we eat, is going to moisten and dissolve food, or begin to moisten and dissolve the food that we are eating to make things easier to digest and break down later on. Saliva itself, even when we are not eating, cleanses your mouth, right? So that itself can help keep teeth clean and that sort of thing. A good example of this, talking about teeth, is this. So I've skipped ahead a couple of slides to show you some teeth. These are not necessarily the healthiest of teeth, right? And some of this can be caused by drying out your mouth. That's like, if that's happened to all of the things in your mouth, we normally joke in the South that that's meth mouth, because a side effect of methamphetamine is that it will dry out your mouth, which does mean that your mouth is no longer self-cleaning because you have dried it out with the drugs, and you will start to lose your teeth from that. These ones, like the gums have receded here. Like, this is not healthy. This tooth is chipped. That kind of bad thing. So that is one job of saliva. It's not only just to help you start digesting and to help start emulsifying the food that you are swallowing, but it is also it also is self-cleaning for self-maintenance for yourself. Right? Yeah. A note about your salivary glands, though, and this is something we haven't had to deal with in the United States in a long time, but we probably will have to due to the surge of anti-vaxxers. So one of the diseases that we protect ourselves from with the MMR vaccines is called the mumps, right? These are pictures of the mumps. So here we have mumps in a small child, and here it is in like a pubescent young man. Mumps is a virus that does attack the parotid salivary glands. Remember, those were the salivary glands that were right here in your cheeks. So mumps is going to affect cheeks, right? Or like make those little pudgy cheeks even worse and more swollen. It's going to cause a decent amount of inflammation of those salivary glands. This is spread by saliva, right? General side effects of mumps is fever, pain when you're opening or closing your mouth, chewing, swallowing, especially acidic foods, and that kind of thing. So if you can imagine this itty-bitty little here with a fever and pain when he opens and closes his mouth and when he's chewing while he's going through teething, that is not something pleasant that I would not wish on any mother. Right? This is why we vaccinate our children against this, so they don't have to put up with this. But a real perk of vaccinating, societal perk, I should say, of vaccinating your child for the MMR, right? In addition to not having to deal with a small, tiny child that ends up with mumps, you do not risk your your post-pubescent teen young man from getting mumps as well. Because mumps has a weird side effect in that, yes, it is spread by saliva, and it does affect your parotid salivary glands. But in a cruel twist of fate, in men, the testes have some of the similar receptors on them that the mumps virus can attach to. So if you have a son that is not vaccinated or does not have his MMRs, if he is exposed to mumps and ends up catching mumps like this young man in the bottom picture has, it is possible that the mumps will spread through his body to his testes. And if the testes become infected, that means that his testicles could also become swollen, inflamed, bad. But a side effect of that is if his testes become too swollen and build scar tissue from that swelling and damage, or if there is lasting damage, catching mumps after puberty for men can actually cause them to become sterile, or that can affect their fertility later on in their life. Because if the mumps virus damages and scars up their testes, that's going to affect sperm production. And we haven't gotten into the reproductive system yet, but that's where all the magic happens for men. So, as a side effect of us now having the MMR vaccine for like 50 years, we have fewer infertile men as a society. Whereas this was more of a problem that men had to deal with 100 years ago or so, right? So just something you should know. Like, even if you are sitting in the anti-vax camp, know that not vaccinating doesn't just affect the small child of your son. It could affect your ability to have grandchildren or his ability to have kids later on. And you should know that when you are making your... I am a full proponent of fully informed decisions, and now you have more information, right? Yeah. So, teeth. Teeth are the main surfaces that you chew on. The crown is the part of the tooth that's above your gum. Fancy word for gum is gingiva. The root of the tooth is what's underneath the gum. And then the neck is the part where it meets the gum. So the neck is that thin little area of the tooth where it meets the gum. Some things about this. So enamel is the safe outer covering, but dentin is the soft calcium that makes your teeth. Once enamel is gone, it's gone. There's no way to get it back. And once sugar and bad things start eating away at the dentin, it's eating away at the dentin. Right? So dentin makes up the majority of your tooth. Underneath the dentin is something called the pulp cavity, which is located in the middle of the dentin, and that's what contains all of your connective tissue, the blood supply, lymphatic vessels, and nerves. So, when you get a dental carie, more commonly called a cavity, it means that bacteria has sat on your tooth, and they have demineralized all of the enamel or protective covering on your teeth, and they have eaten away at the dentin, or they are starting to eat away at the dentin. That's what a cavity or dental carie is, and this is what fillings are for. Fillings are supposed to fill in the space that dentin used to, so that bacteria cannot get there and get deeper into to hit your pulp cavity. That would be very painful or bad if it did, and if that happens, then you're probably going to have like a root canal and that kind of thing. Plaque is the film of sugar and bacterial waste byproduct that is going to build upon your teeth, right? If you do not get all the plaque off of your teeth as plaque is happening, it will calcify and become something we call tartar, which, you have all of your toothpaste commercials say that they have tartar control. You guys know what this is. But tartar is just calcified plaque. You can see it on this individual's teeth. It's this white stuff that's at the base of the tooth that's just calcified. This person didn't brush their teeth fast enough, and their plaque, instead of being like icky, slimy stuff, hardened into hard, white, icky stuff, right? Gingivitis is when you have a bacterial infection in your gums. And periodontal disease is actually, it can kill you. Like, there's something to be said for oral health, and I don't understand why, like, amongst all of our healthcare, we have magically decided that dental, vision, and women's healthcare are not actual real healthcares that aren't covered by normal insurance. Because those three things should be, right? And they're very important. Periodontal disease is diseases that can affect other things, such as like the bone and ligaments that are in there. It's the leading cause of tooth loss because gingivitis or other diseases have gone deep enough that it will affect the tooth's root. These diseases have some consequences to them, which is why I think it should be considered regular healthcare and why dental stuff shouldn't be separate. There is actually a decent correlation between atherosclerosis, like the hardening of your artery walls, and blood clot stuff in your circulatory system exhibited by people that have periodontal disease. So if you don't take care of your teeth and you need help with them and you need a dentist and that kind of thing, but things just keep getting worse, it can legitimately affect your, like, arteries and whatnot, especially those that are around your head and going to your heart. And it's a good indication of, like, heart disease building. So it's more important than more people give it credit for. Please brush your teeth. Right? So we know about our pharynx from the respiratory system, right? It's divided up into three sections. You had the nasopharynx at the top, oropharynx at the back of your mouth, and then the laryngopharynx behind your voice box or larynx. We know that your pharynx allows the passage of food, fluids, and air. It is made up of stratified squamous epithelium, so same stuff that your mouth was made out of. Food is going to pass from your oral cavity. When you swallow, your tongue pushes up against the roof of your mouth and kind of rolls the bolus of food down. And it's going to roll on down until it hits the esophagus. And the esophagus is about 7 inches of muscle. The bottom 2/3 of it have smooth muscle. The top 2/3 have skeletal muscle. Yeah, we've already been through how it moves food down, peristalsis, and it's going to connect your pharynx up here to your stomach, and it moves through your diaphragm. It is one of the few things that goes through your diaphragm here. Right? This is where we can talk about a couple of common things that go wrong with people when they're eating, right? So the area where your esophagus goes through your diaphragm and meets the stomach is called the hiatus. And there is something called a hiatal hernia. Sometimes the muscles and ligaments that keep your stomach in place aren't strong enough and they start to fail. And when that happens as your stomach is churning and moving, sometimes if the ligaments can't hold it in place, it will start to poke up and pinch up through above your diaphragm. This can cause a number of issues because it's encroaching upon it's above your diaphragm now. Your stomach is poking out of your abdominal cavity into your thoracic cavity. So it's going to start encroaching on some space where your lungs could have expanded. It's going to start encroaching on space where your heart normally likes to take up. And not only that, but this is bottlenecking your stomach and preventing your stomach from doing its job because the diaphragm is pinching the top part of it closed. So you have part of the stomach poking above the diaphragm. That is called a hiatal hernia. And that's normally caused by weak sphincters. That is not good. Once that kind of thing starts, if it gets too bad, the only way to fix it is surgery. Although, if you talk to good doctors, they will recommend dietary changes and that kind of thing to help fix it and stave it off first. But that means you can end up with food pouching up here before it moves down below to the other half of the stomach, meaning you could end up with some other complicated issues like heartburn and that kind of thing. Heartburn, or perpetual heartburn, that's called GERD, or gastroesophageal reflux disease, is heartburn. It's when you have a sphincter at the lower esophagus here that closes and prevents things from coming up out of the stomach. Sometimes, depending on what's going on with your body, some of your stomach acid that's inside your stomach may splash up above that esophageal sphincter and into your esophagus. Your stomach, though, is made to handle stomach acid. That's why your stomach is hardcore, and it's good with that. Your esophagus, not so much, and that burns. Sometimes this can occur when you're eating stuff. There may be food triggers, like if it's like super acidic food, or really spicy, or really fatty. Sometimes heartburn happens for different reasons for different people. If you're drinking to excess, like some people, alcohol, this affects it. Obesity can also affect this. Occasionally, if you are running too hard, like if you're training super hard for that marathon and you're just working everything in your body, that sphincter may start to loosen up and you may get heartburn when you're running. Pregnant ladies, hey, baby's kicking you everywhere. If you're pregnant, things happen. You may get heartburn, right? There's not that much. Your baby is taking up more space than you want it to, and he's taking up space for that the stomach could. Many pregnant women also complain about heartburn. But this is what heartburn is. Perpetual heartburn is called GERD. You can go to your doctor, talk to them about options. And a hiatal hernia, which happens in much fewer people, is when your stomach starts to poke up above your diaphragm rather uncomfortably. Right? Oh, I should also mention that perpetual heartburn can permanently damage your esophagus, so if you do have GERD, please go to your doctor and actually talk to them. Occasional heartburn, that could be dietary, not so much, I wouldn't worry. But if you're having heartburn like day in, day out, please go talk to your doctor before bad damage happens. And that brings us to the stomach. So, your stomach. You have 4 regions to your stomach. The cardia is the part of your stomach that attaches to the esophagus. Right? The fundus is this area up here that's sort of extra space and where gas and bubbles go. So like if you're feeling like your stomach is really full from drinking a fizzy drink, the gas and what you want to burp up is in the fundus there. The body is this main part here. And then the pylorus is the tail down here, where you have the pyloric sphincter at the bottom of the stomach that holds stuff in and only lets a little bit out at a time. So those are the 4 regions of your stomach. From top to bottom, you have the cardia, fundus, body, pylorus. Right? And then you have the lesser omentum attached to the lesser curvature on the inside, and the greater omentum attached to the greater curvature on the outside. Right? Let's see. Blood supply to your stomach, generally speaking, is your celiac trunk. Right? And then you have like your autonomic nervous system. You have the splanchnic nerves, celiac plexus, and vagus nerves that all help control this stuff. Right? You have a number of tunicas here, right? Remember when we were mentioning your different layers, your mucosal layer, all that kind of good stuff, muscularis layer? You have 3 smooth muscle layers here, so instead of just circular and longitudinal, you have an oblique one. So your stomach can act like a little like blender and churn food really, really well, so you have an extra stomach layer, or an extra muscle layer. Right? The mucosal layer makes a lot of mucus, and the submucosal layer, right, also form a number of folds. So you have this darker pink layer is the mucosal layer, and then the lighter pink is the submucosal. This is going to make a lot of folds in your stomach called rugae, so that your stomach can scrunch up and like do well and take up less space when it's empty. But when you are eating for like Christmas dinner Christmas dinner, Thanksgiving dinner, something good like that, all of those rugator folds will unfold and stretch out your stomach, and you'll be able to hold like a serving of that turkey that your mom makes, but also like a serving of like ham that your grandma makes for Christmas, all the mashed potatoes in the world, you have the stuffing, like mac and cheese, everything else, and then all of a sudden you see all of the desserts and pies that were made, and you realize that you still have room in your stomach for more. That's what the rugae are for. They're for expanding your stomach, right? So your stomach can grow in size, right? So this is how your stomach does the hormonal control thing of its digestion. The cephalic phase is when you're thinking about food and you're getting hungry, right? So you're thinking about food, you're getting hungry, and it's getting its stimulus, that kind of thing. Gastric phase is when food is actually stretching out the stomach and sending mechanoreceptors to send information back. So this is going to start other reflexes with secreting more stomach acid and making your stomach churn. And then you have the intestinal phase, which is when your stomach is slowing down the secretion of stomach acid, and that kind of thing. But it is still slowly but surely releasing everything into your small intestines here. Right? There we go. So the mucosal barrier, right? Your stomach has a lot of stomach acid in it. We have been discussing this for a while. You know your stomach makes acid, right? This is why throwing up and that sort of thing is not pleasant, right? Your stomach makes a lot of mucus so that the acid that it makes for itself does not burn itself. So the walls of your stomach are lined with a very thick mucosal layer, right? This protects the stomach from self-digestion, so your stomach won't digest itself. And as a matter of fact, that's one of the things that happens after you die. When your stomach is no longer able to repair itself and make this mucus, the stomach acid you have made starts to digest your stomach and break it down, and that's part of decomposition for those of you that wanted to go into the funeral industry. Fun facts, just so you guys know. So this is highly corrosive. We know that stomach acid is bad. So there is a thick, super thick layer of bicarbonate-rich, meaning very basic, mucus to help not get burned. This isn't going to 100% always help your stomach, though, and these cells that are lining your stomach wall, that are going to make the mucus layers and that kind of good thing, will eventually die from the stomach acid and the mucus and whatnot. But these cells are super quickly replaced. The surface cells of your stomach replace themselves every 3 to 6 days. So basically, every week, your stomach has a new stomach lining, because other cells are just burning off from that. Right? There are 3 major types of cells that are going to be in this stomach lining in the wall. You have the mucosal neck cells, right? Parietal cells, which make hydrochloric acid and interferon, and chief cells, which make pepsin, which is the opposite of your stomach acid. So you have 3 kinds of cells. Most of them are going to be these mucosal ones, right? So these little mucosal goblet cells that are making the mucus and maintaining the mucus layer on the inside of your stomach, right? Sometimes, though, they don't always work, and this may be a slightly graphic image for some of you, but occasionally the cells that line your stomach don't do their job correctly, or they can't, or you've eaten something wrong and you have infected yourself with a bacteria called Heliobacter pylori, or H. pylori. Both of those things cause something called a stomach ulcer, right? Stomach ulcers are when your stomach acid does indeed start eating away or burning the inside layer of your stomach wall. So this is a inside image of a stomach ulcer in an area. Like stomach acid was burning this region of the stomach. The scientist that discovered H. pylori was actually so fervent that a bacteria could actually cause this, because H. pylori is one of the very, very few bacteria that can live inside your stomach and the stomach acid. He was so certain of it, and they wouldn't let him test anymore, that he actually grew some H. pylori in a petri dish, mixed himself a cocktail with the stuff, drank it to give himself stomach acid, and then he cured himself of the stomach ulcers that he got from the bacteria he drank with antibiotics, and then he won a Nobel Prize for this, right? Because he used himself as an experiment to prove that this bacteria could indeed cause stomach ulcers, because this bacteria invades the mucosal lining and allows chemical damage to happen. But that's not the H. pylori is not the only cause of stomach ulcers. Smoking is also linked to stomach ulcers. It can weaken your body's protective mechanisms for this and that kind of thing. Aspirin and other NSAIDs, we're talking about medications that will thin out your blood, right? That can cause stomach ulcers. So if you suppress your prostaglandins needed to make mucus and bicarbonate, it's anything you take that does that. Like if you overdose yourself on heartburn medication, you can give yourself stomach ulcers because your body's then not making enough of the stuff to fight against it. Stomach ulcers, normally we let them heal themselves, and this is best treated with either antibiotics if it's the case of H. pylori, or things like Pepto-Bismol that will make your stomach chill out on making acid for a little while so you can give yourself time to just heal up yourself. Yeah. Right. Oh, a fun little note. There are different types of ulcers. This is a gastric ulcer because it is part of your stomach. If you hear something referred to as a peptic ulcer, that means that it's elsewhere in your digestive system. So if you get a peptic ulcer in your upper small intestines, it means that the stomach acid didn't neutralize in time and it burned some of your small intestines. Yeah. Right. There we go. So, chemical digestion, right? Your stomach. Yes. We also talked about those parietal cells a little bit, and we're going to talk about them a little bit more. Oh, yeah, we'll talk about those slightly more in a little bit. First things first. We know that your stomach is going to churn together food while mixing it with stomach acid to chemically break it down. So your stomach simultaneously is mechanically and chemically digesting food down, right? Peristaltic contractions happen about every 20 seconds, so your stomach is just kind of doing its own thing about every 20 seconds. And they're going to ripple down your stomach to help mix everything. Right? At this point, the bolus that we had just swallowed is now called chyme. That's C-H-Y-M-E. That is the mixture of the food you have eaten plus digestive enzymes and juices that your stomach is creating. Right? Your stomach does not dump everything at a time into your small intestines. Your small intestines would not be able to handle that. So it only drops small amounts, like 3 milliliters worth, into the duodenum, or the first part of your small intestines, at a time, so that your duodenum and your small intestines have time to neutralize the stomach acid as it hits your small intestines, because your stomach is built to handle stomach acid, but not the rest of your digestive system. That is important. Typically speaking, after you have eaten a meal, it's going to be emptied away from your stomach 2 to 4 hours afterwards. So when we start talking about your stomach, we have to also talk about stomach acid, right? So your body, in those parietal cells that we referenced earlier, makes hydrochloric acid and something called intrinsic factor. Right? Right? All of this stuff is stimulated. We've talked about your stimulation before. There are neural, which from your nervous system, and hormonal mechanisms to stimulate the production of the hydrochloric acid and the intrinsic factor, right? Stimulation and inhibitory events occur in 3 phases. We've briefly talked about those 3 phases. The cephalic phase, which is your reflex phase. That's a few minutes prior to eating, when you're getting ready to eat and you're oh so hungry and your stomach is starting to growl. Gastric phase, which is after the food is entered and your stomach is mixing. And then the intestinal phase, when it is moving things along. Right? The 3 chemicals that you use, or that your stomach uses to create hydrochloric acid or to stimulate the parietal cells to make hydrochloric acid, are histamine, right? Gastrin, and then something called ACH, right? All 3 of them are necessary for your maximum hydrochloric acid secretion, but you may not necessarily need maximum, right? Remember, we've discussed this intrinsic factor before. Intrinsic factor is needed to attach to vitamin B12 so that you can digest B12 in your stomach, right? So this is why parietal cells secrete, right? Intrinsic factor. And remember that if something is going wrong and your body is not creating enough intrinsic factor, that will cause you to not have enough vitamin B12, which is helpful for blood production and that sort of thing. And if you don't have enough vitamin B12 because of a lack of intrinsic factor, you end up with a type of anemia called pernicious anemia. We discussed that when we went over your blood unit. Right? So pernicious anemia comes back. Now you know what cells create the intrinsic factor for you. Right? We do. So, yeah. Antihistamines are going to block some of those hydrogen receptors to decrease hydrochloric acid release, inevitably, as you are finishing eating. You're going to then have something called an alkaline tide. The alkaline tide is going to occur in the extracellular fluids when digestion occurs in the stomach. Basically, what it means is that blood is draining from the stomach is more alkaline than the blood serving it, right? Which makes sense. You want the blood and extracellular fluid to be slightly more basic around the stomach than acidic, because everything inside the stomach is acidic, right? This is going to stretch, and these shifts in potassium and chloride and other such things are going to happen to maintain that balance, so things can remain balanced. Right? You do have some reflex-mediated receptive relaxation, which will make your hydrochloric acid subside in your stomach after you have finished eating and bring along this alkaline tide to help balance things out. This can also help be coordinated by the swallowing center of your brain, because that's the same section of your brain that will help make serotonin, which serotonin is the hormone or chemical in your brain that helps make you sleepy. Right? So that's why sometimes after you've eaten a big meal with certain things that your stomach is very good at digesting, you will go into a food coma and feel super tired afterwards. Right? Right? And realistically, your stomach is muscle that can be stretched out and exercised as well. So your stomach can only hold as much as it can stretch. Right? Yep. You do not make much stomach acid during infancy, by the way. You don't need much stomach acid to digest mom's milk. There is a protein called renin that will help digest milk proteins that infants have. If you are into food and whatnot, you've probably heard of renin before because we use different types of renin to make different types of cheeses. And I know that sounds gross, but hey, everybody loves mozzarella, and mozzarella is made with cow renin. But you don't make much much stomach acid when you're a baby because you don't need to break down much of mom's milk, right? So now we should talk a little bit about vomiting before we end this video and move on to the small intestines in your next video, right? Right? So, as food, at the end of digestion, as that chyme is entering the duodenum 3 millimeters or 3 milliliters at a time, like we were discussing, receptors are going to respond and say, hey, stomach doesn't have as much in it, it's not as stretched out, and start slowing down those chemical signals to inhibit your gastric secretion of hydrochloric acid, so you're going to stop making acid then. At that point in time, your carbohydrate-rich chyme is going to move quickly through the duodenum, and fatty chyme remnants, so the fatty part of what you've just eaten, can stay in the duodenum for 6 hours or more, while the duodenum secretes CCK and other hormones to start breaking down lipids. And that's where we will end our journey following the food, because now we know what happens when it hits your small intestines and when it exits your stomach into the small intestines. But realistically, we must talk about the disgusting aspect of things. Sometimes that is not the only way out for food, and sometimes you get sick. Vomiting is the forceful ejection of your stomach contents. This can be caused by a number of things, and it is a muscular action coordinated by something called the emetic centers of your medulla oblongata. Emetic, if you see something called emesis, it means you're throwing up. That is your fancy medical term for puking. Right? So this can be caused by a number of things, right? You may have an over-distended stomach, meaning your stomach was too full and your body was like, nope, we can't hold all of this. We need to get some of it out. Same thing happens with your duodenum. If your duodenum gets too full and it feels like it's backing up into your stomach, it would also signal you to throw up. If you have ingested alcohol or bacterial toxins, congratulations, your body may ask you to throw up. Remember, alcohol, like when you overdose on alcohol, we call it alcohol poisoning. A lot of us enjoy the effect of alcohol occasionally. That's why people drink margaritas and whatnot. However, it is a very slow-acting poison that your body can only handle 1 ounce of an hour. So if you overdo it, you give yourself alcohol poisoning, and when your body detects that you are being poisoned, it's going to try to get it out of it, which is what vomiting is. If you have visceral trauma, like if you're punched in the gut too hard, that may force you to throw up. Intense pain really intense pain can also force you to throw up. Sometimes people are more sensitive to this as others, and they can think about gross things enough that will trigger them to throw up. Sometimes the sight of people doing some things or certain smells will also force you to throw up. That just depends upon the individual, right? Generally speaking, before you throw up, you are going to start to retch. Retching causes pressure differences, which is going to open all of the sphincters in your esophagus and dilate your esophagus so that your stomach can get rid of everything it can as quickly as it can. And vomiting is also going to cause tachycardia, sweating, and you're going to produce a lot of saliva to help the stomach acid move through and not burn your mouth. Right. And that's where we're going to leave off from your stomach. We will continue to follow the chyme through your small intestines and large intestines in your next video.